Yeah.
Hafaday Guam and Beyond. I'm Dr. Luan Wentz. I'm here with former Senator Dennis Rodriguez. So he served 4 terms up until 2019.
That's right.
And was the chair of the Health Committee. And currently, he is the co-founder, along with his wife Lena, of Todu Guam. You know, I just wanted to get an idea. So Todu's fairly new. I guess you started on a mobile van, and now
That's
you're
right.
in a physical office. So I just wanted to get an idea. And I think there's more people learning about Todu Guam and the services. So what is the mission of Todu Guam?
Thank you very much for this opportunity. We started in 2016, my wife and I, right?
Yeah.
And the mission back then, and what we finally incorporate ourselves to be as an official nonprofit, was to kind of fill the gaps in services in our community. I was in the legislature at that time. I was the chair on health, so I saw firsthand the struggles that our people face in accessing care, accessing care. And so, we said, okay, we got to bring people together and go out and just provide these services. And so our mission is to provide, to kind of close the loophole in accessing care, breaking down the barriers, and just getting health equity across our island to people that for a very long time have been marginalized.
Right. And actually, I'm kind of curious about being the chair, the health committee. What is actually the role, and what are the kind of designations or roles of that committee, and what do they oversee?
Yeah, so for me, how I understood and how I took and embraced my responsibility as the oversight chair for health was to ensure that the government entities, the hospital, public health, the DISID, for our disabled, had the resources available to them to carry out their work and their mandate of providing services to our people. And so, even before my time, when I came in 2011, the biggest problem back then was the hospital already.
Right.
Not having the proper resources, always having to come to the legislature mid-year to say we need a subsidy. And so when we took a deeper dive and looked at, well, what is the reason why it's happening, right? And so, clearly we saw the hospital was being used by our people as a primary care facility,
right.
Which really is very bad model, bad business model, but bad for our people's health as well.
Right.
And so we worked very hard. I had a very good staff back then to develop a program that would provide access to health insurance, for our people. And so, before I left the legislature, we actually passed it. It was I forget the name, but I know Todu Guam was a part of that of the name. And so we developed a program where, if the executive branch at that time would have carried through and executed it, because our role as the legislature is to set policy, right, and to provide the resources to execute those policies, and the executive branch was to now carry it and to execute it, was to provide a way for a large portion of our community to be able to get health insurance, whether it be through their employers. We had a program there that would provide support to employers. The first thing was to do an employer mandate, taking off pieces from Obamacare, because we knew that the full effects of Obamacare didn't apply to the territories. We didn't get the full funding to implement it, but then we took certain parts of that to make it try to work, right? And so one of it was employer mandate, ensuring that employers provide insurance, access to health insurance, giving them an incentive or some subsidy to be able to, because you tell business, now you're going to have this expense, some businesses will just close down, right? So there was a some mechanism in there that we put in to help that business be able to do that, right? So that was that. It was to increase the poverty line so that more people can qualify for Medicaid. It was to revamp our MIP program. And so, there was a variety of things that we kind of put together in that plan. But unfortunately, it just never was executed the way it was intended to. And so that's why you see even today, the hospital, no matter how much money you pour into it, the resources, if you don't go to the root problem, the root cause, which is fix our people's health, get them access to primary care, let them be able to see a doctor so that you can manage them and get this, make sure they stay out of the hospital.
Yeah.
Right, so that's really the role that I took on as the oversight chair of health, and so when I knew that government can't do everything, that's when we decided to bring this organization together.
Because technically, a lot of the outpatients visits would be handled by public health and the outpatient side, right? But you saw that there's still a gap that they couldn't service that many patients, and you felt that Todu Guam was still necessary to fill those gaps.
That's right. Okay. And when we first started, we called our doctor friends, nurses, allied health professionals, and say, hey, we're going to go out to the community. We have this trailer that we converted into a mobile clinic, and would you come out and volunteer? And so much great people, doctors, nurses, that came out and did that. But I knew back then that that's not sustainable. Coming them out every one weekend every month is not gonna address the problem.
Right.
We're helping kind of chip away at it, but won't address it. So, we had to ensure that it's something that's regular. And so now, we're very happy and blessed that we're able to have this regular access to care for our people. We have a location in the north where we go out there every second Saturday, another location we go out every fourth Saturday, and provide the those residents in that community access to a doctor. And then now we have a center where for that continuity of care, they can come in here to see their doctor and do just for them to be managed properly.
Yeah.
Right. So.
Okay. And it seems like you're growing pretty quickly and having more and more providers just within the last couple months, actually. Yes. So I was curious to, I think the community wants to know what services you offer, what kind of providers or physicians you had, and what services do you offer now? Yeah.
So we are a fully operational primary care outpatient clinic.
Yeah.
So we have great providers. We have Dr. Lee, who is our family medicine a provider. We have a pediatrician. She's part-time, but she'll be coming on full-time soon. Dr. James, she's also a hospitalist. And then in our women's health program, we have now very blessed to have Dr. Sylvia Cruz.
Yeah.
She is she's a local. She left Guam, I think maybe 35 years ago, practiced in the States.
Yeah.
And so she's finally back here now servicing her own people. And so, that was a big need, was the having our pregnant moms have access to prenatal care. Right. And so we brought her in here really primarily for our cervical cancer screening. And so we're doing a lot of that. I mean, the data that we had prior to us starting the program, Guam recorded in a 9-year period about 900 pap smears screenings that were done. We were able to achieve about 1,000 pap smears in a 12-month period. And so we continue to do that because, one of our things here is that prevention is key.
Sure.
Early intervention. We need to really work towards that, right? But besides that, we have our behavioral health program with Dr. Carlos, who's kind of overseeing that, and since being designated as a National Health Service Corps site, we're happy that in beginning November we'll have a full-time psychiatrist on board on island.
Will that be online or face-to-face?
No, it'll be face-to-face.
Oh, great. Okay.
So it's really kind of looking at what the needs are in the community and trying to fill those gaps, right? Yeah.
And going back to OBGYN services, so it seems like you're picking up the pap smears and inevitably you will probably find cervical cancer at different stages. So where would the patient go once they find some sort of pathology or cervical cancer? Like, and are you planning to kind of address that next step if a procedure has to be done?
Yeah, absolutely. So, our process is we take it all the way up to a LEAP procedure.
Okay.
Here, our provider can do that. That's really done in a surgical outpatient setting, right? So we've been doing that. But for those that have seen that if there's any available specialists here, we've kind of referred them to who can, but just very recently that pool has kind of dwindled even more.
Definitely. Yeah.
And so we're trying to get them, what we're doing is getting them to see someone off island, which is really not the best course, especially for the population that we primarily see are those without insurance.
Right.
So our program that are funded through, let's say, partially funded through the Guam Cancer Trust Fund is very limited, right? And so we're hoping that we can expand that service so that if indeed someone does need that referral to a specialist that we don't have here, that we're able to follow that through in getting them that service off island.
Okay. And I believe it seems like you are working towards getting Dr. Cruz maybe more credentialed to be in the hospital or some sort of surgical center so that you can step it up on some of the procedures, as I understand.
That's right. So with her, she's fully she's doing the work already. The one thing she doesn't do is deliveries, right?
Okay.
And so that's why we're trying to work with the hospitalist there, or some other community providers to do that part. But for gyne services, yes, we're trying to work on that. Hoping that this designation we have now on the NHSC, that we can bring in providers that want to come to an island and live on an island and work at the same time, and also benefit from getting their student loans partially forgiven depending on how long they work here.
That's very interesting. Can you tell me a little that perked my interest if there's student loan repayment? Because that'd be a great way to really recruit physicians. I think that's probably one of the best ways to recruit physicians to Guam. So
that's how we really got to. We were talking to several psychiatrists, but for about a year now. And when we brought that up, say, hey, by the way, we just got this certification. So that kind of, pushed that decision over the top, right? Yeah. So as a designated National Health Service Corps, dependent on the program you're on, then your partial of your student loans per year are paid for by the federal government, just for the fact that you are working in a NHSC site, right? And so it was a tedious process for us. We had to meet a lot of requirements. We had a site inspection that was done here, and so very happy with the staff that we had to be able to get us to where we're at today. But absolutely, it's a very big tool to be able to recruit. And some of the questions you asked about, okay, so for cancer, if we see, we're hoping in our collaborations with GRMC and hopefully with GMH, that if we can bring in specialists, then they could be able to address some of these issues, that we're seeing.
Right. And with that designation, is that only applied to nonprofit organizations, or do you know?
I'm not sure. I'm not sure if it applies to all, but I know because Guam's designation as a health professional shortage area, then I believe others. I know Public Health, the Community Health Center, has that designation. I think SDA may have it too, and so we're probably the newest ones to get that designation.
Okay.
Yeah.
Yeah, and when I was reading on your website or some other social media, and I not too long ago I learned about the TMS, which is cranial magnetic stimulation, right? So that's always interesting to me because that's a mode of treatment without the use of necessarily medications or anything really obstructive or intrusive. And when I looked at the studies, it seemed very promising because one of the studies in general psychiatry in a 2019 journal, they took about 196 or 186 patients that were really resistant
Medication.
to medications or standard treatments. And they went through a TMS treatment, and I mean, their response rate was like 55%,
Yeah.
remission was like 60%.
Yeah,
So
that's what we're
pretty
seeing.
good.
Yeah.
So I felt that was very promising. So I kind of wanted to compare notes, like with the patients you're seeing. Are you getting about that same stat, or are you
Absolutely.
getting that? Okay.
I think we're doing like 60% success, you know, and so we were early on, you know, the process. But just if I can share how this came about,
Yeah.
right? So we had a program that started as a social emotional resiliency program that we were doing for the schools. It was the result of the pandemic. There was federal funding available to put a program together. You know, so we did that, but based on the needs assessment and based on what we see even pre-pandemic with the needs of our community, you know, we had to look at something where we could bring in something innovative that we could bring and offer here and put in that toolbox that doctors could use to be able to deal with like the depression, the high levels of depression we're seeing, anxiety, OCD, PTSD, right? And so it was a perfect fit to be able to bring that in and to have our providers have that as a tool, which is non-invasive, it's not dependent on medication, and the science and the evidence behind it on the success rate was something that we had to at least, you know, have it offered here on Guam. And so we've been using it now for a little bit over a year. We of course could do more. A lot of times we have people that are referred here and are you know, cleared the assessment phase to be able to use it, but then one of the biggest thing is that their insurance doesn't cover it, right? So we try to work with them. We have a sliding fee discount program in place here, but even at that it gets difficult. And so there are times that we would just have to, our endowment would cover the costs, you know, for these services. But we're hoping at a certain time that our local insurances can be more open to it. It's not I think they call it experimental. You know, it's gone before the FDA. It's cleared for those 4 specific indications, and it works. Doctors here that have referred patients and have seen the success, you know, really believe in it.
Yeah. So I'm excited. Hopefully we get a little more coverage.
Yes.
I also heard about some of the potential. I didn't realize this, but when I talked to Ashley, your clinic manager and daughter, that it could be practically used for stroke patients as well. And it seemed like you had some good progress with stroke patients.
Yeah. So FDA cleared for depression, MDD, OCD, anxiety, and smoking addiction.
Right.
It's as off-label, right? I mean, a lot of times the medicines we take are not intended for what we take it for, but then they're like, you know, off-label use. But CE, I guess that's the European or the foreign countries equivalent to like FDA or something. There, it's approved for so many other indications, right? Stroke recovery is one of them, Parkinson's, Alzheimer's, autism, and so yes, we did have one patient that used it for that stroke recovery, and it was very successful in terms of the mobility of that patient. And so yeah, it's promising, and it's not new technology. So when we talk to especially our friends in the insurance company, it's not new. It's been around. It's been around for a couple of decades, right? And so it just has to be, you just have to believe it. And so, you know, that's what we're doing, is letting them be able to see the results, and then hopefully it could be more widely accepted.
Yeah. So yeah, we got to go through a tour of the place.
Yes.
You have a beautiful space, and I like to see the chair and the TMS station. But is there anything else you wanted to put out there as a message on behalf of Todu? Yeah,
well, again, thank you for the opportunity. But you know, our message to the community is that getting your regular exams, seeing your doctor early, you know, is key, right? I know for children, You have to, before going to school every year, you got to get your physical exams, got to get your vaccinations. We did a lot of that when we first started, but we knew that was just a surface, right? Because a lot of our patients, even kids, have chronic diseases, and so those have to be managed properly. So for us here, our culture on Guam, unlike places like the Philippines or anywhere else, we're totally dependent on whether it's MIP, Medicaid, or insurance. For us here, we don't look at that, whether they have the ability to pay or not. We'll work something out for them to be seen here. We try to break down those barriers. Transportation too, we're very, if I could just mention, the Church of Jesus Christ of Latter-day Saints donated 2 vehicles to us. One is a 7-passenger van that we've been using to pick up people that say they don't have transportation.
Okay.
So when they call and they say, "Oh, we gotta cancel," no, you don't have to cancel because we'll come pick you up.
Oh, that's nice.
Right.
Yeah.
So people can still come and they just gotta arrange it with us. There's no charge, and so yeah, it's just as we say, it's getting Guam healthy, one man, one woman, one child at a time, and we mean it. It's we just got to start somewhere, and so we're hoping that that's the way we're going to be able to address the big problems we have with healthcare, the cost of healthcare going up, and also with the challenges our hospital faces.
Yeah. Well, thank you. We're gonna check the office out. Let's do a quick tour.
So when we first started in 2017, our first event, it was our first event to launch and do like a first fundraiser, is that we printed these like vision boards, right? And so that was always our flagship, is the mobile clinic. And then, the dream was, okay, next after that clinic, we'll do a mobile dental van.
Oh, nice.
Right? And so that's still part. So we covered the dates because it didn't materialize, but one of the things we've always also wanted to do was to have our brick and mortar, a one-stop comprehensive center, right, to house all of these things. And so we're in that phase now where we're looking at the next 2 years to be able to. We started that process already, right? We have our A&Es that are being worked on, and hopefully in 2 years we can have that center going, right?
It's the conference.
And this is where we do like programs, like we had like an art therapy session here.
Oh, okay.
So we had like 30 kids.
Wow,
that was
okay.
here.
Nice.
We had like this visiting artist from Korea that they came with UOG and they did like some session here. So we have 2 machines now. This helmet, the green one, is for the smoking addiction. But this is the one that would have the other indications, whether it be for stroke recovery or Parkinson's. That's the one. That's what they would use. The blue one is the MDD. That's really what is used a lot, for anxiety. So really, when you do this too, there's nothing you need to prepare for. You can go to work right after. They just ask you like if you're a heavy coffee drinker, that you just maintain that and you don't go like before coming in here, you drink like 3 cups more, right? And so that kind of affects the treatment process.
Do you feel something?
On my head, but
On
not
your
on.
head? Not
Yeah.
on your head, no.
Yeah.
There you go. You see how it was? Yeah.
Did it move?
Yeah.
Yeah.
Okay.
2. So are you ready?
And it doesn't hurt. It just feels like someone just tapped you on the head.
Yeah.
Yeah, and then some patients feel, every patient feels a different sensation. So sometimes they feel like jaw locking. When I do it, I feel like one of my eyes closes, but yeah, it's not uncomfortable. It's just kind of weird. So this would be your treatment area. So it's the MT. Yeah. So right now, that's at 120%.
Yeah.
That's optimal treatment. So
I
when
see.
patients start, we
It's lower.
start them at 100%.
Yeah.
And then over the course of 3 days, we keep adding 10% so that we can hopefully, first we add 5, then we add 5.
Okay.
then
So about how what percent do you go up to? What's the
120, that's optimal.
So I just had
treatment.
maximum?
Yeah, you just had
Oh, okay.
maximum.
Yeah, that's not bad at all.
How can we get the maximum?
So that you can feel it. Yeah, so that's what
Okay.
the patients would feel.
Cool. I'm alive.
But some patients fall asleep,
Yeah.
you know, with that. So I guess it's just your own preference.
Yeah.
You just fall asleep.
You said
but-
that cycles every minute?
Every minute.
So 20, I guess, 20 shocks. Okay.
So yeah, it's this is an amazing thing to be able to see and then to see the outcomes, right? So.
Okay.